Thank you for tuning in for our 1 o'clock Wednesday press conference. I enjoy the opportunity to talk to everybody and provide you with the information that we hope makes you feel that you can be informed and armed with everything you need to know in order to keep you and your family safe as we deal with coronavirus. As a reminder, we'll do this every Wednesday at 1 o'clock, but I would strongly recommend that you sign up for daily emails at governor.ri.gov, governor.ri.gov. Please sign up for the daily emails. If you haven't downloaded the Crush COVID RI app, I think nearly 80,000 Rhode Islanders have. Thank you. If you haven't, I'm urging you to give it a try, especially now as we're gearing up to go back to school, college students coming back. It's going to be more important than ever that we stay informed, track our symptoms, get tested if necessary. So Crush COVID RI, please download the app at the Apple Store or on Google Play. We begin, as I always do, with the data. I'd ask you to please put up the data slide. Yesterday we had 74 new cases of coronavirus and sadly another 2 deaths. 74 is feeling better, certainly, than the days that we've had of over 100. And so I want to thank you for trying a little bit harder to follow the rules. If we follow the rules, we'll be in a good place. If we don't, then we'll be in trouble. We'll be back over 100 a day, hospitalizations creeping up, and then we'll have to shut down the economy, which we really don't ever want to have to do again. Okay, today I want to spend the first chunk of time talking about schools. It's that time of year that everybody's starting to think about school, and obviously this year is different. We're doing this for the first and hopefully last time, and we're getting a lot of questions around what's going to go on with school. So for each of the past few weeks, I've dedicated a portion of this press conference to schools. And last week, we put up a slide highlighting the 5 metrics that we'll be tracking as we consider whether it's safe to return to full in-person school. We have statewide data. We have to check the box to make sure that the prevalence of the virus statewide is in a safe place, municipal data, supplies, testing, and then operational readiness at the school and district level. And I've spent the past couple of weeks providing detail on those first 2 metrics and outlining the criteria by which we will determine if a particular city or town can go forward with full in-person learning or if they have to choose a more limited option. Today, I would like to talk about some of the other metrics, and I also want to start with the question that's on everyone's mind, which is the metric we call operational readiness. So is the school ready to open? Do they have the safety measures in place so that they can open? Are they ready to open under the new protocols? To that end, I want to thank the school administrators who've been working very hard to make sure that the schools will be safe and ready to open. Having said that, it is a Herculean task. Do not underestimate the task. It's doable. We're going to do it. Our kids deserve it. But it is an awful lot of work in detail. You know, these are the questions that we're asking districts to come up with answers to. Do you have plans in place to transport the students safely to and from school? Have you made the facilities upgrades necessary to accommodate for better airflow, enough fresh air in every classroom? Are you able to build and maintain stable groups for all grades? We want the kids to be in a stable pod. Have you readjusted the traffic flow, you know, in the schools? You know, we want kids moving in one direction and not bunched up in the hallways. Are there special precautions in place for at-risk faculty and at-risk students? Are there plans in place to make sure that every child and every teacher and everyone in the school will always have a mask on? Now, I'm sure I want to address this. I've been getting this question a lot. People say to me, but Governor, have you seen those pictures of schools in Georgia in those first couple of days and weeks of opening? No one's wearing a mask. Folks are bunched up. It doesn't look like there's any social distancing. Yes, of course, I have seen those. That's not Rhode Island. We are in a much better place in Rhode Island. I see those pictures, and that to me is a cautionary tale. That's what we won't do. We're not going to open schools until they're safe. We're not going to open schools until we're sure and confident that that won't happen, because we have the systems in place to prevent that from happening. I know there's so much anxiety right now among parents, and I know really as a parent, all you want to do is the right thing for your kid. Children learn best in school. That we know to be a fact. Children have struggled mentally, physically, emotionally, intellectually by being out of school. It is the right thing to get these kids into school, and also the right thing to make sure the school has the systems in place so that the kids and teachers are safe, so that when we open school, it doesn't look like those pictures. So yes, I'm aware of them, and that's why we're working so hard to make sure the precautions are in place here. That's not going to be us. That will not be our experience. To that end, in the time that I have been talking to teachers and superintendents and principals and teachers and parents, the message we're hearing, they're doing a good job, they're making a lot of progress, they're working hard. They have been saying we need just a little bit more time, just a little bit more time to finish our plans, to outfit our classrooms, to do the necessary work. They're getting close, but some of the details aren't worked out, and they're asking for a couple of more weeks so that we can all feel confident that when we say it's time for school to open, we will be ready. So based on the recommendations of the Department of Education and the Department of Health, today I'm announcing that we're pushing back the start date of public schools and our statewide calendar by 2 weeks. So kids will begin the school year on Monday, September 14th. And I'd ask you please to put up the calendar with put up the slide with the new school calendar. Why are we doing this? We're doing this because it gives schools a little bit more time to be ready. A little more time to make sure they have enough PPE and masks. A little bit more time to make sure that they have a way to keep windows open or have airflow. A little more time to figure out how they're going to get the kids to and from school safely. And so that's why we've made this decision, so that you can have confidence that when we open school, we'll be in good shape and the children will be safe. If you take a look at the calendar that's before you on the screen, you can see the change also allows us to set aside 3 professional days, professional development days for teachers, September 9th through 11th. These will be days that teachers can have professional development, frankly, to learn how to educate in the midst of this crisis. It's a good opportunity for educators to learn the new protocols, to learn the new safety protocols, to learn some new skills on how to educate children in the midst of this coronavirus. I think this is extremely important. I think the teachers need it and deserve it, and it'll allow them to be better educators for your children. So with those changes and the later start date, we're adjusting the last day of school to June 25th so that children will have at least 177 days of school. So push back the start date by 2 weeks. Kids get out the 25th. They'll have 177 days, and teachers get 3 extra professional days so they can learn and be prepared to teach children in these extreme circumstances. I will say, I hope, listen, this is tough. There's no easy decisions. This is an anxious time. It's my hope that if you're a parent, if you're a teacher, if you're a principal, you're a superintendent, you take a breath. That's what we're doing. We're working furiously to review these plans, and we're getting close, but just take a breath. This gives us a little more time. We're going to work just as hard. We're going to work just as fast. We owe it to the children to get them into school, but take a breath so we can finish the planning so that when we come back on the 14th, people have confidence. You feel confident We have the systems in place, operational readiness, to safely educate our children. Now, I want to address something. As we push back the calendar start date by 2 weeks, I'm also pushing back the timeline for making the final determination as to whether a school will return fully in person versus partially in person. So I had said that we were going to make that decision based on the data August 16th, but now we're going to be making that decision the week of August 31st. Now, I realize not everyone's happy with that decision, and I understand that. Let me just tell you why we've chosen to do that. You know already the metrics. We've been very transparent. They're online, back to school. Go to the website, back to school. There's 5 metrics. You know how we're going to decide whether you'll be fully in person, fully virtual, or somewhere in the middle. Everything depends on the data, the prevalence of the disease in the state and in your community, and also, is your particular school ready? And also, is the state ready with testing? I can't make a decision, we can't make a decision based upon the data of August 16th for what we think the prevalence of the disease is going to be like September 14th. It just, it wouldn't be right. It wouldn't be accurate. This is something that changes every day, every week. So the safest, best thing to do is wait until the 31st, make that decision, and then go ahead and operationalize that decision. Now, I know a lot of you are saying, ugh, we just want to know now. It's hard to plan for every eventuality. And you're right, it is hard. And I'm sorry, this is so hard. But it is what it is. The other thing is, right now, one of the metrics before you is testing. We don't want to allow schools to open in person unless we know that everyone can get tested and have a result within 48 to 72 hours. We're not there yet. Today, I could not honestly tell you that we have the ability to do that. It is my hope that by August 31st, we will be able to, which is another reason why I want to buy a couple more weeks. So I would say we're going to keep working 24/7 to get these schools ready to receive our children safely. The week of August 31st, we'll make final decisions. School's going to begin September 14th, and whether it begins fully in person, fully distanced, or somewhere in the middle in your town will depend on those 5 metrics and whether you're ready on those metrics as of August 31st. So I hope that is helpful. I know it's far from ideal, but I feel like it's the right balance between getting everyone in school and doing it safely. And I will tell you, I personally have spent I don't know how many hours with teachers, parents, superintendents, school committees, charter school leaders, in the past 10 days, and they're working really hard. They're working, by and large, working really hard to do the right thing. And I have come to the view that a bit more time will allow us to be fully ready with our testing, with our transportation, with our cleaning, so that we can have confidence when the children go back. I want to make 2 more comments. One is about transportation. We know one of the biggest operational challenges as we think about sending the kids back to school is transportation. Most kids get to school on a bus. Most buses are crowded. Most kids don't sit in their seat silently looking forward the whole time on the bus. I know I didn't as a kid. So it's not simple. You can't just put the same number of kids on a bus and hope for the best. We have to have fewer children on the bus, the windows have to be open, there should be bus monitors, and the kids have to have their masks on, which means it's going to be different, and this is a challenge. So for our part, we've put together a team of experts from the National Guard, Department of Education, the state's Department of Transportation, and RIPTA buses to help districts come up with workable solutions. So far, these districts are being very creative, and I want to thank you for that. I'm going to push you to continue to be creative, and we're going to help with the National Guard, transportation, RIPTA. We want to push a little more to see if we can come up with even some more creative options. I will say, you know, creative options could be children walking to school, children biking to school, ability to pick kids up and walk them to school, scootering to school, you know, different forms of buses, different forms of vans. We are looking at it all, and you know, again, that these next couple weeks, we're going to finalize the plans. A lot of schools are thinking about staggered start times. Not everyone can arrive on the same bus at the same time. So I'm saying this so parents understand school's going to be very different this year. Transportation is a challenge. We've put the state's experts and the National Guard transportation experts on it, and we're going to do our best and work hard over the next few weeks to ensure that kids can get to school safely, starting on the very first day of classes. I also wanted to address testing. As I said, testing is key. Testing is absolutely key to the puzzle, key piece of the puzzle. The reason we're keeping children in pods of 30 is so if somebody gets the virus, we know they've really just been contained to that group of 30, and so we want to quickly test them, test folks around them, and put people into isolation or quarantine. As I said, we want to make it so that when we open school, everyone can get their test results 48 to 72 hours. We're not there yet. I'll be very candid, we're not there yet. We also know that things happen during the day. Kid might go into school feeling great, might start to get sick halfway through the day. We need to be able to do rapid testing on that child, or on the teacher, or on anyone in the school building. Teacher starts the school feeling great, halfway through the day starts to come down with a fever. We need rapid testing in school. So it's two things we're setting up. Regular testing, 48-hour, 72-hour turnaround, and then rapid testing. I want to tell you what we're doing and why I'm confident we're going to be ready by the 31st. We've already secured, since I talked to you last week, we've already secured 8 rapid testing machines to process the rapid testing for schools. Just yesterday, last night, Rhode Island joined a 10-state collaborative to help us procure the test kits that we will need. Right now, we have the capacity to run about 700 of these rapid tests per day, and we're working to procure more machines and more supplies. So again, that will allow us to make it so that if a teacher or student feels sick, we can test them rapidly. We joined a consortium with 10 other states and the Rockefeller Foundation to purchase testing supplies together so that we'll always have enough of these supplies and an uninterrupted supply. So 2 pieces of good news. Again, I hope you breathe a sigh of relief that when we're up and running with schools, we're going to have the testing capacity necessary. I've heard this a lot from teachers. I've told teachers we won't send you into a work environment that's not safe. We're making progress. And I've heard it from parents and even kids. So I want you to know we're getting there, we will be there, and we're taking the right steps. Okay, I want to switch away from schools and talk about a few other things. I want to talk for a minute about social gatherings. I want to remind everybody the social gathering limit in Rhode Island is 15. 15. A lot of people still don't know that, and I understand that. It's changed a lot. So I want to make it crystal clear. 15. And it's not a different 15 people every day. Write down a list of 15 people that you will be with and stick to that group of 15 people. It is the single most important thing we can do to help our situation. Listen, a month and a half ago, Rhode Island was leading the nation in how low our prevalence was. And we're still in good shape. Thank God we are still in good shape. Still test positive of 2%. We're off the list for New York, New Jersey, Connecticut. but we're not where we need to be. We are not where we need to be. We're not as good as we were, and we're not as good as we could be if everyone followed the rules. Hospitalizations are creeping up. We still have days with 100 or more cases per day. Come on, we have to get kids back to school. I'm hearing from bar owners who are struggling because I had to shut the bars at 11 o'clock. I want to get them back open. They deserve to be making a living, a better living. I can't do it unless everyone in Rhode Island tries a little harder. All of us, me too, my family too. 15 people, stick to it. In the first 5 days after launching the new Crush COVID State Police unit, from Wednesday through the end of the weekend, the unit received about 400 calls. Men and women were sent out to investigate 76 of those calls. And they found 4 violations of the social gathering limit: house parties with 25 people, a street party of more than 40 people, backyard get-togethers of 30 people. In every instance, those parties were broken up immediately without incident. If it happens again at one of those locations, every person will get a $500 fine. If the state police or a member of that task force shows up and you don't immediately disperse, everyone will get a $500 fine. We're serious about this, folks. We have to get more serious. We have a month. We have a month before, we want children to get back to school. We want to get this economy back to be strong. We're at a real tipping point right now. So I know it's summer. I know it's hot. I know it's a time to have parties. I know it's a drag to wear a mask when it's hot out. You need to do it. We need to see 100% compliance with mask wearing. Last week, we inspected hundreds of restaurants, retailers, and gyms. Mask compliance among employees wasn't where we needed it to be. It had gone down. Mask wearing among customers had gone up, so good job, customers. I say we've been at this for a while, and it's easy to feel that we don't have to do this. The reality is we do. If we don't, more people will die, more people will lose their jobs, fewer children will be able to go to school, and it's here. You can't fight it. So please, 15 people, keep your social gatherings small, and wear your masks. I'm not making any changes today. The 11 o'clock hour for bars to be closed remains in effect. We've seen broad compliance with that. I want to thank you for that. And we're keeping everything in effect until we see our numbers going down. A lot of people have said to me, when are you going to ease up? Numbers have to start coming down. And it's on us to make sure that happens. Last thing I will say is this. If you're having a party, if you're having a social gathering, write down the names of the people who are there. It will help us. We've learned that from other states. They have that policy. It's a good policy, and I would ask you, if you know you're having your family over, or you know you're having a few friends over, emphasis on a few, write down the names and phone numbers of those folks. A question that I receive very frequently is, therefore I'd like to address it now, is how come social gathering limits are 15, but you're allowing, weddings and catered gatherings of much greater than 15, and for kids in school, the pod is 30. And it's a good question, and we hear it a lot. We hear it a lot, especially in schools. So I'll say this. A school environment where people are primarily in a classroom with a seating chart, or in a cafeteria with a seating chart, wearing a mask, is a relatively controlled environment. The same is true at restaurants. But you go in, you're seated, you have your mask, people know where you're sitting. It's much more controlled. Social gatherings is where we're having trouble. As we look through all the contact tracing, social gatherings are the issue, where people are crowded together on a beach, crowded together at a party, crowded together in a street party in a park, no mask wearing, sharing food, close in contact, no 6 feet apart. So in those instances, it's really important that we have a cap of 15, and that is very different than a stable pod of 30 in a classroom with a seating chart with mask wearing in a much more controlled environment. I want to talk briefly about contact tracing. This is an area where Rhode Island stepped up early, and the experience of every other country that has handled this well, Germany, South Korea, Singapore, it's very clear that contact tracing is key to stay ahead of the virus. The quicker we can track down somebody's contacts, monitor for them for symptoms and get them tested, the more effectively we can stop the spread. I will share with you today, we need to do a better job with contact tracing. Our team needs to make greater investments in contact tracing so we can scale, so we can be ready for school. And we're doing that. We are absolutely doing that, putting more people on the project. And everyone in Rhode Island needs to do a little bit better of a job as well. So I want to ask you for a few specific things. Number one, I want to ask you again, please keep your contact tracing journal. You're probably sick of hearing me say that. I understand that. It is so simple and it makes a huge difference. Get a little notebook and write down at the end of the day, who have you been in contact with? I promise you it'll save lives, it'll save jobs, it'll help you be healthier. Secondly, as I've already said, if you're having a get-together of any kind, I'm asking you, if you're the host, write down the names of the people who are at the event. And then finally, and this is the biggest one, if you get a call from someone from the Department of Health, please take the call. Please answer the phone and provide your information. I know some people are reluctant to provide the information. I want to assure you that all the information you provide is protected by the strictest privacy standards under HIPAA. No one will have that information. I will say, and Dr. Alexander Scott can go into it in more details, when we started this, nearly everyone we called answered the phone and gave us the information we asked for. That's much less so the case now. So we are looking at more creative ways to let you know that it's us on the phone. But I'm asking you, if you get the call, please answer the call. Don't be afraid. The information's going nowhere. It's really the only way we have to control the disease. And the questions are just going to be, who have you been in contact with, where have you been? But we need to increase the rate of participation of folks answering the phone and giving us the information. And when they call you, it would be very helpful if you had your contact tracing notebook or the list of places you've been or the list of people you've been in contact with. Finally, last reminder for today, I want to remind everybody of the golden rule in this pandemic. Don't leave your house if you're sick. I'm going to say it again. Don't leave your house if you're sick. If you have a headache, if you have a fever, if you have a stuffy nose, the sniffles, normally you might go to work. Don't leave your house if you're sick. This past week, when we looked through all the data, and we looked at all of the people who had tested positive, who had been to work, half of them were at work sick, had some kind of symptoms. If you're sick, if you have symptoms, if you're sneezing or coughing, you are much more contagious. We need you, please, to stay home. And I want to remind you, if you're afraid to stay home because you're afraid you'll get fired or you're afraid you'll get in trouble, I want to remind you, by law, by federal law, every employer is required to give you 2 weeks of sick time with pay. 2 weeks with pay, 10 days. If your employer is giving you a hard time and making you go to work sick, telling you you won't get your sick time if you're sick, I want you to call me, because it's not right, it's against the law, and it's not fair, and it's hurting everyone else. If you don't want to call me, report them to the Department of Labor, 866-487-9243. You need to stay home if you're sick. If you're an employer who's hearing me say this, if you're a manufacturer, we're seeing things in manufacturing operations. If you're a retailer and you're pushing folks to come in even when they're sick or threatening that you won't pay their sick leave, you're breaking the law, we're going to find you, and you will be punished. It isn't right. And by the way, it's enabling the spread of coronavirus for everyone else. It's not in your best interest. I know there's pressure. I know there's pressure to go to work. Listen, I typically, pre-corona, I would go to work sick. I would take my 2 Tylenol and head to work. But we can't do that now. It's actually your civic duty to stay home if you're sick. Don't feel bad for staying home if you're sick. You're doing the right thing by staying home if you're feeling sick. Last week, actually, I had a Facebook Live with Dr. Philip Chan of the Health Department. He's an expert in infectious diseases, and he was talking about in school, we have to change the culture in school. This year, probably schools shouldn't have awards or certificates for perfect attendance. We don't want to put pressure on anyone to go to school when they're sick or to go to work when they're sick. So anyway, same thing, by the way, we're seeing prevalence of the disease spreading in carpools. It's the same thing. If you feel a little bit sick and you get into a carpool, you're going to get everyone in the carpool sick. And if you have the virus, then that's an outbreak. If you go to the manufacturing operation, then you have an outbreak there. If you go to work at a retail, same thing. So we went through the data, and we're seeing a high percentage of folks who test positive went to work or someplace when they were sick. Don't go to church if you're sick. I can't say it enough. The golden rule is if you feel a little bit under the weather, stay home. And probably a lot of people are hearing me say this and say, yeah, but that doesn't apply to me. I have a really important job. Yeah, but that doesn't apply to me. I don't have the virus. Yeah, it applies to you. Please stay home if you're sick. Finally, before I turn it over to the Commissioner, I want to invite you all to join me tomorrow on my Facebook page at 3 o'clock. I'll be joined by Dr. Fauci. Dr. Anthony Fauci will be with me having a discussion around schools. Dr. Fauci has been a great resource to us from day one, but also he's really excellent when it comes to advice around how important it is for children to be in school and what we have to do in order for it to be done safely. So tomorrow, 3 o'clock, my Facebook page, join Dr. Fauci and I as we talk about what it means to be safe when the kids come back to school in the fall.